I want to talk about the real cost of the robotic approach for rectopexy. As we've seen earlier, there are different ways to do a laparoscopic procedure for rectal prolapse, and we in the Netherlands, in Meander Amersfoort, have chosen to do the robot-assisted ventral rectopexy. We have the same goals as anyone, to restore anatomy and to improve functional results. So why do we use the robot? We've talked about that earlier. We think you can do a perfect dissection up to the pelvic floor. With a 3D view, you have a better recognition of the nerves, especially suturing deep down. It's a perfect tool for deep suturing. I think a very important issue is the better economics for the surgeon, especially if you go way down in the pelvis. It's just stuff on your shoulders, and if you've been in the robot for a day, you don't feel anything. It might be faster in the end. At this time, I think we have the same operating times with the robot and without the robot. And as you've told earlier, the setup time, the docking times, they just go down if your team is more experienced. So it might be faster in the long term. Important, if you look at the cost, you need to know what do you need if you do a robotic rectopexy. I don't know what's happening now. I think we better go back here.
Turn your Wi-Fi on, that'll probably be really to do.
So how do we do that? I'm sorry. Just try to go back. All right, see if this works. So what do you need? Of course, you need the robot. We have a 4-arm setup. When I wrote this talk, we still had a 12mm camera. Now we often use the 8.5mm camera. For the rest, important is what do you need for the robot. We use 2 needle drives. We use a dissection hook and we use a pro grasp. Of course, a dissection device, standard reusable instrument for the assistant. We use a Prolene mesh. We use non-absorbable sutures and a tacker, and we use the V-lock. Then you have some costs. If you start, we have dedicated headrest, shoulder support. This is all different from laparoscopy. So we have a plexiglass cover for the robot. And one of the reasons that we have all of this is that we really need to be sure that once you put the patient in the body straps, you cannot move the patient anymore. So we really want to be sure that the Trendelenburg position is absolutely perfect before you start the operation. If you do it laparoscopic, you can change your position during the operation. So we added some cost having this. Well, we don't do it this far, but if we want to, we can have a 45 degrees Trendelenburg position. And in some really big patients, we need to do this. And you just want to be sure that the patient is not falling off the table when you have the robot docked. So what are the extra costs if you use the robot? Most of the things that are on this slide are the same in laparoscopic procedures and in the robot procedures. But we need to look at what kind of instrument for the robot we need. We need 5 instruments. We have 2 pro grasps, 2 needle drives, a dissection hook. The drape for the robot you have to pay. There's a disposable that you have to pay for. And of course the Da Vinci robot. And if we, important, of course you can look at other costs if you have shorter operating time, shorter length of stay, cheaper workup, but we cannot prove that it's cheaper to do it with a robot if you look at those parameters. So the extra cost of the robot will be in the cost of the robot and in the disposables that you need. A robot costs about 1.8 million euros to buy. And if you say, well, you use the robot for about 8 years, that's 225,000 euros per year. Then you have some extra costs in maintenance, which is about 10% of the original price. So that's another 180,000 euros per year. So just having a robot without doing anything costs you over 400,000 euros per year per robot. And then it really depends what is the cost of using a robot really depends on how much do you use the robot. We try to get to about 400 cases using the robot. So if you do 2 procedures per day, 5 days a week, 48 weeks per year, then the extra cost is 840 euros per procedure. But when you just start using the robot, you don't have as many indications, and we've seen when we started using the robot, we didn't get to 480 procedures. You are close to 100 or 150 procedures per year, and then the cost really, really gets a lot larger, because then the cost is over 4,000 per procedure, and that's just for the use of the robot. Then, of course, you have the extra disposables. For any surgery you do for the robot, you always have to have the drapes for the robot, which are 250 euros. And the instruments, you can use the instruments, I think it's 10 times per instrument, but the cost for an instrument is 225 euros every time you use one instrument. I use 5 instruments for the rectopexy. Some of my colleagues use 4 instruments. It's not a big difference, but that's another 1,375 euros per procedure. So if you add those costs, that's 2,000 euros, that's almost $3,000 per year, per procedure. If you do, and I think that's the maximum you could do with one robot, if you do almost 500 cases with one robot. The cost really gets a lot larger, get to $7,000 if you only do 100 cases with the robot. So with that in mind, if we look at the Dutch situation, we have 19 robot systems in the Netherlands. In most of the academic centers we have the robot, and in 12 of the non-academic hospitals we have the robot as one center with 2 robots. We are a teaching hospital in the center of the Netherlands with 600 beds. And we want to have the robot, so we wrote a business case, and I think it's important that we did this together with the urologist, with the gynecologist, and with general surgery. The health insurance companies were at first unwilling to give us the robot. There's not enough evidence what they said, but in the end they felt obliged to offer this to their clients. And I think they mainly did this because we had a good business case with 3 specialties. So whatever way you put it, the robot rectopexy is more expensive than doing it laparoscopically. And as I've shown, the extra costs are between $3,000 and $7,000 per case. You can bring down the cost by doing more robot surgery per year. And I think it is really important to share the cost between different specialties. And maybe the main message is we need more evidence to convince health insurance companies that it is better. So I think the main effort we should put in doing research and show people that we can do it better with the robot. Thank you.